USMLE style question. Transposition of the great arteries. Newborn boy is evaluated in the NICU for cyanosis that does not improve with supplemental oxygen. He was born at 38 weeks via an uncomplicated vaginal delivery. Physical examination reveals a loud single S2 and mild tachypnea. Chest X-ray shows a narrow mediastinum, egg on a string appearance. Which of the following embryological processes failed to occur properly in this patient? A. Abnormal migration of neural crest cells. Failure of the aorticopulmonary septum to spiral properly. C. Defective fusion of the endocardial cushions. Failure of the foramen primum to close. E. Malformation of the fourth aortic arch derivatives. Failure of the aorticopulmonary septum to spiral properly, nation. Transposition of the great arteries, TGA, is a cyanotic congenital heart defect caused by failure of the aorticopulmonary septum to spiral properly during development. This results in the aorta arising from the right ventricle and the pulmonary artery arising from the left ventricle, leading to two parallel circulations that do not mix. Key features of TGA: severe cyanosis within hours of birth, right to left shunting needed for survival. Egg on a string appearance on chest X-ray due to narrow mediastinum from an anterior aorta. Single, loud S2 due to abnormal valve closure. Tachypnea but no murmur unless a VSD is present. Immediate management: prostaglandin E1 infusion to maintain a patent ductus arteriosus PDA for oxygenated blood mixing. Balloon atrial septostomy, Rashkin procedure, to create an atrial septal defect for mixing. Definitive treatment: arterial switch surgery, Jettine procedure in the first weeks of life. Why the other answers are incorrect. A. Abnormal migration of neural crest cells causes tetralogy of Fallot, TOF, or persistent truncus arteriosus, PTA. C. Defective fusion of the endocardial cushions causes atrioventricular septal defects, AVSDs, common in Down syndrome. D. Failure of the foramen primum to close causes atrial septal defect, ASD, which is non-cyanotic. E. Malformation of the fourth aortic arch derivatives associated with aortic arch anomalies like coarctation of the aorta, not TGA. Key takeaways: TGA is caused by failure of the aorticopulmonary septum to spiral properly. Cyanosis is severe and does not improve with oxygen. Oxygen-resistant cyanosis. Survival depends on shunt formation, PDA, VSD, or ASD. Egg on a string, CXR appearance due to a narrow mediastinum. Would you like